Hello and welcome to Wine Wednesday with Crow's Physical Therapy.
Cheers.
Cheers. I'm Dr. Tiffany,
And I'm Dr. Mike.
and on this episode of Wine Wednesday, we are going to talk a little bit about the difference between acute and chronic knee pain and how it is that we may treat them differently. First, I'm just going to talk about acute versus chronic, and generally speaking, we talk about acute injuries as being something that has just happened within the first couple of weeks. Once you get beyond that first couple of weeks, we consider it more of a chronic problem.
Mm-hmm.
Now, in terms of acute versus chronic and what everybody always thinks about also, a lot of times people will say when you first have an injury to put ice on it, and when it's been more chronic in nature that they like to have heat on it. That doesn't always come into play, but again, just addressing some of those common stereotypes. So Mike's going to talk a little bit about how we determine what's going on and treat them if there is any difference between acute and chronic knee pain.
There's really not a great deal of difference in how we treat somebody who comes in with a chronic condition versus an acute condition, with the exception of immediately beginning proprioceptive training if somebody's, say, sprained an ankle or a knee. But in the typical treatment that we engage in here, chronic and acute are treated virtually the same. We look for dysfunctions in all of the joints of the lower extremity to make sure that the extremity is functioning efficiently. Say when you walk, when you go up and down a step, or when you go from sitting to standing, those joints have to align appropriately and move appropriately to reduce the stress. So just like any other area of the body, we look at how well the joints move from a mechanical perspective, how much or how well the muscles initiate the movement of that joint or body part or region, and then how strong they are and how long those contractions can last. So that's our mechanical, neuromuscular, and motor control trio that we look at with everybody that we treat.
All right. Thanks for watching, and cheers.
Cheers.